في معي دغري موجود، سيد الكرم وجود، كرمك في نيجيريا، كرمك في أروى، ما عليه حدود. بابا زلو شكرا مننا، بابا غنا يلولو كمرنا. الله الله الله. زلوف شكرا لله.
Borno State is one of the states in Nigeria with the highest maternal mortality rates, recording over 1,000 deaths per 100,000 live births. The state faces significant challenges in maternal and child health due to prolonged conflict, displacement, and a weakened healthcare infrastructure. To reverse this trend, the Borno state government, under the leadership of Governor Babagana Umar Azlam, is leaving no stone unturned in strengthening the state healthcare system with view to address these problems squarely. The Ministry of Health and Human Services, under the stewardship of Professor Baba Malam Kana, has introduced various policies and programs aimed at reducing the persistent maternal and neonatal mortality rates. One of these major initiatives recently launched by the ministry is the Safer BIRTHS Bundle of Care SBBC program, an evidence-based intervention designed to reduce maternal and newborn mortality by improving the quality of care during childbirth. The program focuses on implementing a set of proven interventions, the bundle of care, to address the major causes of preventable death during labor and delivery. The launch of the SBBC initiative in Borno represents a critical step towards improving childbirth safety for women and newborns in the state. The first phase of the initiative was launched by the Borno State Ministry of Health with support from Norwegian Church Aid and other partners. The objective of SBBC initiative is to reduce maternal and neonatal mortality by 30% in Borno State through strengthening emergency obstetric and newborn care, training healthcare workers, doctors, nurses and midwives in SBBC protocols, improving the availability of essential drugs and medical supplies, strengthening referral systems for emergency cases, and engaging communities to encourage facility-based deliveries.
In the glory of Allah, on behalf of His Excellency, the Executive Governor of Borno State, Professor Babagana Umar Azlam, CON, MNI, FNSD, FNIAB, the Executive Governor of Borno State, to officially flag off this program. Thank you and God bless.
During the launch of the SBBC program at Malakachala Primary Healthcare Facility, Governor Babagana Umar Azlam reaffirmed his administration's commitment to providing accessible and affordable healthcare services. Represented by the head of service, Dr. Mohamed Aminu Nguluze, the governor highlighted that allocating 15% of the state budget to healthcare demonstrates his administration's dedication to improving the well-being of the people of the state.
It is with deep sense of purpose and great optimism that I stand before you today at this flag-off ceremony of the Safer BIRTHS Bundle of Care approach, a pivotal step in our shared journey to protect the lives of mothers and newborns in Borno State. We are gathered here not just to launch a program, but to reinforce our collective resolve to end preventable maternal and neonatal deaths in our communities. The health and survival of women and children are not just health sector priorities, they are moral, social, and economic imperatives. Nigeria's maternal and newborn mortality rates are among the highest in the world. The statistics are sobering, and Borno State is not exempt from this reality. That is why we welcome with open arms the Safer Birth Bundle of Care initiative, an evidence-based and integrated intervention designed to improve facility-based care during childbirth through training, innovation, and accountability. As a government, we have always placed the health of our people at the forefront of our development agenda. I am proud to note that Borno State allocates no less than 15% of its annual budget to the health sector, in line with global commitments. This is not just a number, it reflects our enduring commitment to a healthier, safer future for all Borno residents. We have also launched and sustained several health initiatives, including free maternal health services for all pregnant women in public health facilities, the revitalization of our primary health care system across the local government areas, recruitment and development of skilled health workers, a growing investment in digital health across primary and secondary healthcare facilities. Let me make it abundantly clear that Borno State government is committed to doing all it takes to crush maternal and neonatal mortality. We will not relent until our women and children can access quality, life-saving care, irrespective of where they live or what challenges they face. The Safer Birth Bundle of Care initiative being launched today is beginning in 4 health facilities in MMC and Jere local government areas. But we see that not as an end. We see that not as an end in itself, but as a large part for a statewide transformation. We are confident that with the continued commitment for the government and support of our partners and donors, this model will be scaled up across the state.
In his address, the Commissioner of Health and Human Services, Professor Baba Malam Kana, stated that the SBBC initiative marks a significant milestone in the collective effort to reduce maternal mortality in the state. He explained that the program combines simulation-based training, innovative clinical tools, and continuous quality improvement to enhance facility-based care during and after childbirth.
It is with great pleasure and deep appreciation that I welcome you all to this important flag-off ceremony of the Safer Birth Bundle of Care, in short SBBC, approach here in Borno State. Maternal mortality remains a pressing global health concern, and sadly, Nigeria bears a disproportionate share of this burden, with the maternal mortality well above 500 per 100,000 live births, and infant mortality of well over 41 in 1,000 live births. The urgency for systemic reforms in maternal and newborn health cannot be overemphasized. To address this crisis, the Federal Ministry of Health, ably led by Professor Muhammad Ali Pateh and the Executive Director of National Primary Healthcare Agency, Dr. Moy Aina, has identified that there are 172 local government areas across the 33 states of Nigeria where the burden of maternal mortality and newborn mortality is highest. Unfortunately, Unfortunately, Borno State has got 13 local government areas that have been identified among these 122. These include in the southern part, Bayo, Biu, Shani, Howell, Dombua, and here in the central zone, we have MMC, which is where we are, Jere, Kanduga, Paga, Mafar. And in the northern part, we have Monguno, Damasak, and Gubio, respectively. There is need to critically focus on these strategic interventions in these areas, in these local governments in particular, in Borno State, to save the lives of mothers and their newborns. Today's ceremony marks a significant milestone in our collective efforts as we formally launch Safer Birth Bundle of Care initiative, an evidence-based, integrated maternal and newborn health intervention. This approach, which comes with simulation-based training, innovative clinical tools, and continuous quality improvement, is designed to strengthen facility-based care during and after childbirth. The pilot phase of this program will be rolled out across our healthcare facilities in Maiduguri, MMC, and Jere, initially in 2 primary healthcare, which Malakachella primary healthcare is one of them. That's why we're doing it here today. And the 2 will be done in secondary healthcare facilities. Though this initial phase is modest, it holds great promise. We are hopeful that with the demonstrated success, this initiative can be scaled up across all the LGS in the state, especially those LGS I've mentioned earlier on, who are known to have high burden of maternal mortality as recorded by the Federal Ministry of Health.
The Commissioner expressed deep gratitude for the unwavering support from Governor Zulum's administration, emphasizing that such commitment has been instrumental in achieving progress.
I wish to express our profound gratitude to His Excellency, the Executive Governor of Borno State, Professor Babagana Umara Zulum, for his unwavering commitment to improving the health and well-being of the people of Borno State. His visionary leadership and consistent support have made initiatives like this possible.
The Coordinating Minister of Health and Social Welfare, Professor Umar Ali Pate, represented by the Executive Director, National Primary Healthcare Development Agency, Dr. Moy Aina, applauded the Borno State government's multifaceted approach to tackling maternal mortality. He noted that 13 local government areas in Borno are among the 172 local government areas in Nigeria with the highest maternal death, assured the federal ministry's support in extending the program to cover all
of the Safer Birth Bundle of Care approach is very momentous, not just for Borno State, but for all of us, because it fits right in when we talk about alignment with the SWAP approach. It fits right in with the Nigeria Health Sector Renewal Investment Initiative that is being led by my boss, the Honorable Coordinating Minister for Health and Social Welfare. I'd like to express my thanks on behalf of myself, but also my boss, who, by the way, sends his regards. Before I should have said this in the beginning, and he has to head to Chad for another meeting, and that's why he was not able to be here. But sends his thanks to His Excellency, the Executive Governor, and the entire team in Borno State, because you continue to inspire us. The way I put it to my friends, the Honorable Commissioner, is that Borno makes our job easier. This is one state that you don't have to worry about. You know what your issues are, you understand it, you're early adopters of technology, and many more often than not, we come here to learn from you what to do, in the other states. So really thank you for that.
So the Federal Ministry of Health and Social Welfare, through the swap coordination office, in collaboration with the National Primary Health Care Development Agency, but also other agencies, the NHIA, NEMSAS, and GO, like has been said, identified 172 high-priority local government areas for the Mani program, which account for more than half of the maternal deaths in Nigeria, as places to start. That's not where we're ending, but that's where we're starting, with the states, the interventions. 13 of these LGAs are in Borno, and it's very important that we act very swiftly with all of you here in these LGAs and beyond to be able to crash maternal mortality and newborn mortality as well, as per President Bola Ahmed Tinubu's Renewed Hope agenda. The Mani program, which has been mentioned, is implemented in a context-specific way that makes sure that every pregnant woman, and her child get the care that they need through the journey of pregnancy, from when a woman is pregnant through the 9 months to the time that she delivers and the immediate aftermath of it. The needs of each woman is different, and the idea of the Mami program is to bring all of the resources to bear that they need so that they get the care they need, to get the diagnostics that they need, to get the commodities and the tools that they need.
In their remarks, the Chief Medical Director, Hospital Management Board, Professor Abubakar Kullima, and the Executive Secretary of the Borno State Primary Healthcare Development Board, Professor Arab Alhaji, emphasized that, given the substantial investment in the healthcare sector under Governor Zulum's leadership, all necessary resources have been mobilized to ensure the success of the SBBC program.
One is to appreciate the current intervention that we are launching this morning. First, as an obstetrician and gynecologist, I'm on the burn of simulation, improving the skills of our healthcare workers who are always battling to prevent the recurring non-decimal donator theft. I saw also take over the videos I was to say, but Somali quality. All the challenges we're facing, there are a lot of infrastructures government deals. A lot of supplies in terms of drugs and the package of disease. And there are a lot of innovations that are being carried out in years. But one critical perspective is keys by itself, particularly dealing with emergencies. And I'm sorry this is not many here, but we are going to introduce states courtesy of Innovator on a church in support from the radio domain. It definitely the foundation for us to start reducing the scourge of maternal mortality in states. I'm living with this for what is being travail, and I've seen how they were able to achieve these tremendous statistics. Now, this is statistics that were given to us in the public program and updated out by the police. With the intervention, I want to assure you we have the both from my living there. They were going to assiduously follow this protocol and ensure that we achieve success. On behalf of Borno State Primary Healthcare Development Boards, one of the major implementing agency or boards in the states, I want to assure this gathering and also to inform the gathering that the governance and leadership exhibited by His Excellency through his political will and commitment has made the BORNO State Primary Healthcare Development Board as one of the boards, dynamic and performing boards across the states, without missing word in the presence of my Executive Director of National Primary Healthcare Development Board. We'll be given all the supports, everything we ask for, and therefore, let me assure this gathering that all the workforce are already mobilized to ensuring the success of this program.
The country director of Norwegian Church Aid and the SBBC program coordinator from Tanzania shared insightful testimonies on the program's success in Tanzania.
We are confident that this ambitious goal will be realized through strong leadership and continued support of the BORNO State Development, our by donors and our dedicated partners. Excellencies, ladies and gentlemen, every child born on this immense profession was our work. Today's leaders, innovators, designers, scientists were once yesterday's children. Let us work together, hand in hand, to safeguard the lives of tomorrow's leaders, scientists, inventors, through effective and efficient implementation of this BBC project. Finally, taking this opportunity, I would like to sincerely recognize the Norwegian Agency for Development NORAD for funding this crucial phase of the project. We are hopeful that the positive outcomes and demonstrable impact of initial implementation of this project will take the way for under crucial elite case and muscular.
In their goodwill messages, representatives from UNICEF, the World Health Organization WHO, UNFPA, and other partners also pledged their support to the program.
I think this is a testament of the commitments of these states, but also testaments of collaboration across borders. We know that this initiative has been tried and tested on the other side of the continent in Tanzania, made echoes, and now also been taking it all the way here to BORNO State to see how this promising approach can also be applicable here in BORNO State. I believe the time is now. It's not always that we see this much commitments for mothers and children. Just this week, here in Maiduguri, we have the launch of the MAMI, which looks at how we can tackle the maternal newborn mortality and some of the highest mortality RJs. But then at the same time here today, the launch of the SBBC, which would also be a component, I believe, of the MAMI initiative. Because we know to crash maternal newborn mortality, we need to tackle it from many different angles.
This program, as highlighted earlier, is an integrated maternal and newborn intervention, which is designed to strengthen facility-based care during and after birth. And it also marks a pivotal step forward in our collaborative efforts to reduce maternal and neonatal mortality. This initiative goes beyond just being a health program. It is indeed a promise. It is a promise for our mothers. It is a promise for our sisters. It is a promise to our daughters. And indeed, a promise to communities that every life matters. We should be reminded at this moment that no woman should lose her life while trying to give life.
In his closing remarks, the Permanent Secretary of the Ministry of Health acknowledged the remarkable and unprecedented support the healthcare sector has received under Governor Zulum's administration. He extended appreciation to all stakeholders who contributed to the successful launch of the Safer Births Bundle of Care program in Borno State.
The entire people of Borno State indeed have the obligation of continuously praising and thanking Almighty Allah, the Supreme, the Beneficent, and the Merciful, for blessing the state with the leadership of the Executive Governor of Borno State, Professor Babagana Umara Zulum, CON, MNI, FNSC, FNIAE. The healthcare sector particularly is witnessing its golden era with the unprecedented commitment and will to strengthen and reform the health sector for better and improved outcomes. The Abuja Declaration committing both national and subnational governments to allocate 15% of their annual resources to the health sector has been achieved in both the 2024 and 2025 annual approved budgets. The challenges of health infrastructure have been squarely addressed with the construction of several new ultra-modern and specialized hospitals in Biu Monguno, Mapa, Magumeri, Gubio, Dikwa, Uba, and other communities. Health facilities destroyed by insurgency have already been reconstructed, rehabilitated, and equipped. Human resource in health challenge will cease to exist with the establishment of the College of Medical Sciences in Borno State University, the Borno State University Teaching Hospital, College of Nursing and Midwifery in Manguno and other parts of the state. The plugging up of the Safer Births Bundle of Care intervention implemented in the state by the Ministry of Health under the able stewardship of the healthcare sector reformer, Professor Baba Malangana, FRCS, FCIS, in collaboration with the Norwegian Church 8 NCA, Ledel Global Health, Safer Norway, and Hayden Lutheran Hospital is a game changer in crashing down maternal mortality to the barest minimum in the state. We must profoundly thank His Excellency, the Executive Governor of Borno State, Professor Babagana Umara Zulum, CON, MNI, the reformer-in-chief of the Borno State healthcare sector, for the approval and indeed and support for the takeoff of this laudable project in the state.
The journey to reducing maternal and neonatal mortality in Borno is far from over. But with the Safer Births Bundle of Care initiative, there is renewed hope. Through strong leadership, strategic partnership, and community involvement, Borno State is paving the way for safer births and healthier future.
في معي دغري موجود سيد الكرم وجود كرمك فيني جريا كرمك في أروى ما له حدود شكرا مننا بابا قنا يلولو كمرنا الله الله الله